repos everywhere.
We used to, but then we stopped because of the expense.
Some in Winnipeg are being forced to choose between their health and their finances due to the cost of ambulances in the province. The issue shown in a spike of complaints around ambulance billing in recent years.
I think I've adjusted to it. I think we both have. But yeah, I mean, it's even just, having somebody else there while it's happening.
Corey Reed's loved one, Glenn Hoban, is living with epilepsy and experiences seizures as a result. He says the episodes can be scary and sometimes last several minutes. He used to call an ambulance to ensure Glenn's safety, but that's no longer the case because of the cost.
He doesn't ask to have this disorder, and it just feels really unjust to even be charged at all.
He's not alone in his concerns around the cost of ambulances. There were 308 complaints recorded in 2022 where a person was unable, unwilling, or did not have the necessary finances to cover the cost. That's an increase of more than 224% when compared to the low recorded in 2020 of 95, and an increase of more than 100% when compared to the previous 5-year average of 150. Reed says the province, which sets the price for ambulances, should make the service free, as people should not have to be thinking about their wallet when they're worrying about their health. Shared health covers a large portion of the bill, but patients will be out of pocket anywhere between $237 to more than $950, depending on the situation. Shared health did not immediately provide comment. The Winnipeg Fire and Paramedics Service, which facilitates billing on behalf of the province, said in a statement that the spike could be attributed to the fact that distribution of reminder invoices stopped during COVID-19, with an increase in complaints expected when the reminders were sent out.
Well, it certainly would be a barrier, and $250 is a lot of money to many people.
Christian Srida says he too is frustrated by the billing system after he was blindsided by a late bill last year, which he could not get covered by insurance due to what he calls a lack of response from WFPS.
It's relieving to know that mine isn't an isolated case, that it seems to be a systemic issue, because it doesn't make any sense that if they want people to pay their bills, why they make it so difficult.
WFPS says the majority of complaints are related to payment concerns and arranging payment. They say residents should always call 911 if they are in or witnessing a potential life and death emergency, stressing, quote, WFPS works closely with recipients to make arrangements to make them more affordable through extended payment plans if needed. WFPS can also work with bill recipients to identify agencies that may be able to help with the cost. In Winnipeg, Morgan Majeski, City News.